or something that has impacted them that they, will remember for the rest of their life is, hey, this happened to me, this happened to my hometown or wherever I was. And so for me, that's Hurricane Michael. I come from Southwest Georgia, and that hit the Gulf of Mexico and the Panhandle of Florida the day I interviewed for my job here now at the Institute. So going on 7 years, and that impacted my hometown. It was something that, we had never seen before. We're still, 100 miles inland from the coast. And that was 2018. And now we see Hurricane Helene, we see all these others. And it's like, wow, it's really not just the coastal communities. We're seeing more of those inland impacts as well. So we'll talk about a few of those things, but that's my hurricane there. So our presentation outlook or forecast for how this presentation is going to go, we're going to do our day one. It's going to be cloud cover, which is kind of our background, our basics on emergency preparedness. And then day two, we'll move into checking the forecast, which is going to be some of our severe weather outlooks for this season, primarily hurricane season. We'll focus on that for today. Day three, again, not real days, but day three is going to be packing your poncho. So this is, okay, how do we actually apply these best practices? What are they? How do we go through that planning process so that we're prepared at the facility level? And then lastly, day four is blue skies ahead. So thinking about those community partners that can really help us plan for these disasters before they happen, how they can assist us during it, and then afterwards in the recovery as well. So that's our agenda for today. Our first section here, some of our background. So when we talk about emergency preparedness, what is it? We want to make sure we're all on the same page in terms of definitions. And you could honestly take a class at a university for a whole semester debating about what is preparedness. But for today, we're going to use the definition of measures taken to prepare for and reduce the effects of emergencies or disasters. So some other interchangeable terms often, emergencies and disasters. But emergencies typically are something that you can handle on your own or within a small group, kind of an internal issue. So if you're at your healthcare facility and, you're under a wool water advisory, something like that. It's like, okay, yes, that's an emergency. Like that's an issue. We need to get maintenance and engineering. We need to get our dietary staff, environmental services. Where's our bottled water? Okay, make sure we're not, washing our hands in the dirty water, anything like that. But we can generally handle it internally. We're not going to have to, reach out to the state for assistance because of a wool water advisory, typically. So something we can handle, something you get home at the end of the day and you tell your spouse or your family and you're like, wow, that was just a crazy day, but we figured it out. It's good. We're going to be okay. A disaster, on the other hand, is something where you have to reach out externally for more help. So maybe you typically reach out to a sister facility or your corporate level, even if it's just a notification of, hey, this is what's going on. If that's not enough, if you need more support, you need support from emergency management or your healthcare coalition or your state level government, your federal level government, that's going to be something that we would classify as a disaster, is when you have to reach out for more help for that. So a couple differences there, but generally we talk about emergency preparedness, emergency management, even if we're mostly applying it to disasters here. Then our next point here is, why is it's important? So first off, it's required, right? There's a lot of regulations and regulatory guidance and rules and all these things surrounding emergency preparedness at the facility level. So if you are a federally, funded facility, if you follow CMS Appendix Z, you have all of these different requirements for that. Even if you're not under CMS Appendix Z, you still have requirements at your state level for different facility types. So you do have some requirements for that. And that, of course, is important, but we really want to make sure that we are doing these things to make sure we're in line with our top priorities and to decrease any sort of chaos or confusion in a crisis. So our top priorities here, number one is always going to be life safety of your residents, patients, clients, however you refer to them, depending on what facility type you are or organization you are. Your second priority is going to be your property. And then your third priority is your business. So, number one is pretty easy. You think about life safety of the people you're caring for, but also your staff, also your volunteers that show up at your facility that happen to be there when something happens, or even your staff's families. If they show up and try to shelter in place with you, well, now you've got to take care of them too. And so, life safety can be yes, are we good? We're watered, we're fed, we're breathing, all of that. And it can also be, way on down the road of, do we have enough toilet paper for everyone in our building? We weren't expecting all these people to show up, and here we are. So thinking through everything on that. And then the second priority here is going to be property. So it's going to be really hard to care for your staff, care for your residents without a roof on your building. If your building is a foot underwater, it can make it a lot more difficult to do that. So doing some things to protect your property. So again, kind of be more in the mitigation area than preparedness, but still, maybe putting out sandbags, that would be a preparedness activity before you see some rain coming in, a hurricane coming in. So doing those measures to make sure you're protecting your property and therefore supporting those life safety efforts. And then lastly, our priority is going to be ensuring that our business is secure, is stable. We know there are, all these changes going on at the federal level, and that trickles down to the local level. And so funding in general is a very big question mark these days. Staffing is always an issue, being understaffed. But if you don't have a sturdy business continuity plan after a disaster, you could very well end up going out of business from something like that. And it's very hard to take care of your residents, take care of your staff, pay them, make sure they can take care of their families if you're going out of business. So it's not something that's always thought of immediately in terms of emergency preparedness, is that business continuity piece, but it's something that's absolutely important. Excuse me one moment. Okay. And back where we were. Our building is so eco-friendly, it likes to turn off the lights on us. So we have to move more often. So going into our hazard types here, generally there are three different types of hazards when we talk about emergencies and disasters. So the first category is going to be your natural hazards. Then you have technological or human system failure hazards there, and then terrorism or violent events. And so I would love to hear from y'all in the chat of some examples of a natural hazard, if you can think of one, something that may impact your facility, maybe a technological hazard. Any examples y'all can think of that you want to put in the chat here? Um, I'll wait a moment. All right, no worries. So for our natural hazards, we're going to be thinking about anything that is Mother Nature caused. So Mother Nature could be hurricanes, tornadoes, flooding, drought, heat, snow, anything like that. Pandemics typically will kind of fall into that category. Fire, of course, is going to be in there, earthquakes. Technological hazards is going to be anything that is that human system failure. So you think about those systems like transportation systems or water, power outage, cybersecurity, anything like that is going to be your technological hazards. And so it can be really difficult to plan for the technological hazards and even the terrorism and violent events because there's often not a season associated with them. So if you think of your natural hazards, you think of hurricanes, okay, great, you have a hurricane season. Even tornadoes, you have times of the year that you might expect them more than others. But with cybersecurity, the season for that is every day. So it can be really exhausting and just kind of mentally taxing to really think about all the things that you should be preparing for on the everyday level, like power outages and anything like that. So it can be a little bit more difficult to plan for, but absolutely crucial that we're preparing for those things. And then our last category here is terrorism or violent events. And so this is certainly something that, we don't wish on anyone. We don't wish any of these on anyone. And they can be really difficult to talk about, but they're very important to plan for. So most likely it's not going to be an active shooter event or something like that, although we have seen it at long-term care time and time again, more often than not, it's a domestic violence situation. Maybe an ex shows up to your facility and is fighting with, a member of your staff or something like that in the parking lot. And you're like, wow, this is none of my business, but based on where it's happening, it is now your business. Like you have to handle it, you have to deal with it. So making sure that you have clear plans, policies, and procedures in place for how you're going to deal with any kind of hazard event, anything like that is going to be really important. Make sure. Okay. So, if you would put in the chat here, I'll continue talking here, but just which hazards have impacted your organizations? What have you had that has impacted your organization? Did you experience Hurricane Helene? Did you experience a different hurricane? Flooding, power outage, what have you had? And you may be like, what have I not had at this point? But that's fine. Go ahead and put that in the chat if you would. This picture here on the right-hand side is, from the flooding of Hurricane Helene in Greenville. And so um, a lot of times we hear in disasters and the news media and immediately following it is like unprecedented times. I think we're so tired of living in unprecedented times post-COVID, especially. But this was, something that was newer is seeing all of these impacts from the flooding and all of that from more inland communities. The coast is very used to, okay, hurricanes coming in, we know our evacuation zone, we're going to leave. All right, we've got our transportation plan, all of that. But it's like, wait, what if we don't need to contraflow, the interstate and actually it's inland? So still we're learning, as human populations and as, government systems and all of these things, we're still learning how to handle these. And we're still learning a lot of the same lessons over and over again, unfortunately. But this is certainly a little bit of a new one. And so thank you for putting that in the chat. Yeah, AC out, that is a big one, especially, if you're in the summer, hot time of the year. We're in the South, so we know, a heat impact is going to be basically year round around here. So, and I'm again from Southwest Georgia, so it's like Christmas, do you really spring for the sweater? Or are you going to be in shorts? You just never know. So, definitely an issue. And then flooding, snowstorms, Helene. Yeah. Thank you, Patricia, for putting that in there as well. So, a whole host of issues, and it can be really difficult to think about all the things you need to prepare for at that facility level, right? So what we're going to do now is focus a little bit more on the current season that we are experiencing, which is the hurricane season. So I know there's already been a few disturbances in the Gulf and trying to figure out if it's going to become anything or not. And honestly, it can be really exhausting to just keep up with the different disturbances that may turn into a tropical depression and then a storm and then a hurricane. So it's very good. We get a lot of information on hurricanes a lot earlier than we used to, but sometimes you're like 3 weeks in of watching the Weather Channel and you're just like, man, can it get here already? Can we just see where it's going to decide to go so I can make my decisions on if I should stay or go? It can be really exhausting trying to, uh, you know, go through all of that information. But this is from the National Weather Service through NOAA, their National Hurricane Center, and this is their outlook for 2025. So you may have seen this before, but basically they put out their predictions every hurricane season for how they think the season is going to go. And so this one is for the Atlanta hurricane season. So that is what we're looking for is on the Atlantic side. And so far they're thinking it's going to be, above normal. So they're thinking 6 to 10 hurricanes this season with 3 to 5 major hurricanes. And so a major hurricane is anything that's over a category 3. So category 3, 4, and 5 would be a major hurricane. And 3 to 5 of those is, not a comforting number. You hope that you don't get any in a season, and then you hope you only get one. But if it's one and it's like Hurricane Helene and what it did to North Carolina, then that's plenty. Like we don't even need that, right? So if you think about 3 to 5 and the likelihood that, maybe it's multiple hitting one area back to back, that can be really difficult to navigate as well. So that's what we're looking at for this season. Of course, those are predictions. So we want to talk about a few basics of hurricanes. Of course, we're all familiar with what they are, but I want to talk a little bit more about the scale here that's listed on the right-hand side. And so, as I mentioned, it can go from a disturbance to a tropical depression to a tropical storm and then to a hurricane. And so, what determines that to go from a tropical storm to a hurricane is strictly wind speed. So, it is not a hurricane until it hits winds of 74 miles per hour, and that's going to be a category one. And then going up to that major hurricane level is going to be category three and above. So that's winds of 111 miles per hour. And then a category five you see is 157 and above. And so this is something that we as humans, we want to put a scale on everything. We want to be able to compare things. Well, how bad was this one compared to that one? Well, it was only a whatever, category two, category one. But we don't want to solely focus on whatever category a hurricane is named because the hurricane categories are only based on wind, and most hurricane deaths are actually due to water. So, due to storm surge, due to flooding. So, storm surge is when your coastal, like ocean waters, become more inland. Flooding is just, maybe a hurricane has really slow moving and dropped a lot of water in an inland place, like Hurricane Helene. So, a lot of big issues there with water. And so, even if it's a category one, it can still be very dangerous. It can be slow moving in terms of, how quickly it's moving over land, and it can drop 2 feet of water on you, right? So 2 feet of water anywhere is not a great idea. So really want to make sure we are paying attention to all the factors, not just what category it is for wind speed, but all of these other factors as well as how quickly it's moving, where is it's headed, where are you in relation to how the hurricane is moving? Are you on, the front end or the back end? And how is that going to be affecting you differently based on how strong that storm is? One moment, please.
Alyssa, while you're doing that, we have had a couple of comments in the chat talking about facilities who were needing to run on generator power. And while and considering staffing and the effect on infection control and prevention that a storm may have and how those should be considered.
Absolutely. Yeah, absolutely. And so, y'all are familiar as well with, 1135s that like may be issued, but those are still for very specific things like caring for, your patients in a different location. You still do have to maintain, your infection prevention things there as well. So it can be really difficult to plan for and to manage. So absolutely great considerations. And I'll talk a little bit about that at the end about another program that's available. So yeah, so with hurricanes, unfortunately, we're seeing stronger and stronger hurricanes, and that is due to our climate change. So as the oceans are warming up, they are producing stronger hurricanes. We're seeing more extreme weather events like the flash flooding events in Texas recently. And so it's unfortunately not going away. It is an ongoing trend here that we're going to see more of these extreme weather events, whether it is water or heat or cold, whatever it is. It's just going to be more extreme due to that increased base level temperature. But with hurricanes specifically, we want to be worried about the rain that we mentioned. Hail can also be really common in hurricanes that I don't know that a lot of people think of as a typical thing. So, like if you have a covered area to park your vehicles, anything like that, move stuff indoors, patio furniture, whatever it is, even at your facilities, trying to pull that kind of stuff in for wind and for hail. And then tornadoes. A lot of times we get tornadoes that spawn off from a hurricane. And of course, in Georgia, South Carolina, the Southeast, we don't really get the pretty hurricanes. We don't get the Kansas ones where you like see it from a mile away and you're like, wow, that's gorgeous. But also let's, take shelter. Um, Ours are more at night in the middle of the rain. You never see it coming, and you hope you hear some sirens, and you may not know it even happened until you see it, the aftermath. So then you see your lights and sirens and your responders. So all of this makes it really difficult to make that ultimate decision of should I stay or should I go? And that can be really difficult to do with hurricanes. So we get a lot of information a lot earlier, as I mentioned, but you still don't really know where it's going to happen. You don't really know how bad it's going to be until it happens. So you have to really take all of that into consideration. So something that can help you make that decision is making sure that you're staying up to date on all of your communications. So at the facility level, you want to make sure that you have a documented, updated, trained on, and exercised emergency communications plan. So any sort of backup communications devices, radios, different phones, different apps, messaging systems, whatever it is, you want to try and test those with your staff regularly. So we often say quarterly, you should be pulling out your radios at a meeting and say, hey, we're going to do this meeting with these radios and do some training again. Can we all turn it on? Do we know what channel to go to? Do we know where they're stored? Do we know how to charge them? All of that. So you want to make sure you have all of that information in a communications plan. So it's something that is just known and able to immediately be implemented whenever a disaster happens. The basics of emergency communications here are going to be who, how, and what. So who are you going to talk to? Do you have all of your contact information available? Do you know your community partners? Do you know your power company account code? If you call and say, hey, I'm out of power, one of the first questions might be, well, what's your account number? And if the person calling doesn't have that, there's going to be a delay in some response times. So having all that information available, how are you going to contact them? So if the phone lines are down, if the internet is down, what are your backup communication modes? Do you have that contact information in other forms for everyone that you're going to contact? And then lastly, what? So if you contact them, however you contacted them, what are you going to tell them? Do you have the information that they're going to be asking? Do you need information from them? Do you have a list of EEIs, essential elements of information? Just a quick list of like, hey, here are some basic things that you should probably tell some other people, like your current building status, your current census, what's your ambulatory versus non-ambulatory, split? How are we looking on that in case you needed to be transported? So those are some basics of communications there. And then really want to make sure we're tuned in to our weather alerts and notifications. So if you are getting notifications from the Weather Channel, from the local weather, from any other weather app, do you have those notifications turned on? Are you going to get that notification in the middle of the night that says to, seek higher ground? Making sure you're following the National Weather Service and the National Hurricane Center offices that are near you. So, like Tallahassee, Jacksonville, Atlanta, whatever it is, making sure you are following them on social media because they'll be posting, updated things of here's how the hurricane's looking today. And it can be really easy in this day and age to get inaccurate information. So we want to make sure that we're, getting that information from the source really accurately. And so the National Hurricane Center is going to be your best bet for that. And then also following your local government, your different officials there. Different communities are more active than others on social media, but it can be a really quick way to say, see, oh man, this storm came through, and actually the road I normally take to work isn't even working anymore. It's not open, there's a tree on it. So I need to go another way, or maybe I don't need to go to work at all. It's just not looking good out there. So making sure you're identifying how you're going to get that information before a disaster, that you're already used to receiving that information. And if necessary, you're building those relationships. So those are really key as well. All right. And so another thing to emphasize at your individual facilities, and I apologize if you don't agree with facility as a term. We say organization and facilities. I'm used to more skilled nursing bits here, but whatever your community is, we just want to make sure that we're fostering a culture of preparedness. So yes, your facility is required to be prepared. You're required to have, your 72, 96 hour, whatever it is, backups of food, water, your medications, anything like that. But what about personally? Are we making sure that our staff members are also personally prepared? Because if something happens and you have your facility stocked to the brim, you're ready to go, got everybody on the phone tree, all right. But if they're not prepared personally at home, if they don't have backup childcare, if they don't have, food to last a few days at their house, they're very less likely to come into work and actually do their job if they're not prepared personally, if their family's not going to be okay without them. It's going to be really difficult for them to come into work. So making sure that you are, just pushing that out as, hey, yes, a storm's coming. This is what we're doing at our organization, but also remember to go home and do this as well with your family. Have a stay and go kit for your family, for your pets. Have one in your car. So if you're out on the road, your summer car kit is going to be a lot different than your winter car kit, different things that you may need so that you can continue to travel. But just an extra little component there that we really want to be pushing out. It's just that culture of preparedness all the way down to the individual level for our staff members as well. And I do see in the chat that, yeah, definitely staffing is an issue. It's always an issue. And then certainly with an event, hurricanes, at least you have a little bit of a more of a warning typically, and you can kind of see if you're going to do a team A, team B, whatever it is. But for several of these other incidents, you may not have warning, and trying to figure that out can be really difficult at the time as well. So something else we want to emphasize as a preparedness best practice here is having an emergency preparedness kit. And so this goes into your facility level preparedness as well as your personal preparedness. And we have actually put together a lot of these kits through our previous grant projects in Georgia and in South Carolina. And we have built these for skilled nursing, ambulatory surgical centers, dialysis, home health, hospice, and our CRCFs. So we have built a lot of different iterations of these with different budgets. If you had an endless budget for this, it could be, 10 times the size, but also not as portable. So anytime you do it, it's going to look a little different. But just to give you an idea of some categories of items to include in a kit, it's going to be emergency power and lighting. So we always include headlamps. So you want your hands-free lighting, as well as some lanterns for area lighting, something you can, put in a hallway and try to light, a couple rooms at a time if you need to, some flashlights. And if you can find devices that also charge your phone or use batteries and a plug-in, dual charging purposes, those are really great as well. Then you want to consider food and water. So, of course, you're required to have those, but thinking about ways, are you able to transport that really quickly if you have to evacuate, anything like that? Then medical and first aid. So, yes, your basic everyday medical needs, but what about severe bleeding? What if you're, transporting and, someone cuts themselves or something and you have to have a tourniquet or hemostatic gauze, something like that, that may not be your typical medical supplies. Do you have those things available? Glucose tablets, anything like that for quick on the hand items there. Then emergency communications, of course, is really important. So we always want to make sure we have a weather radio in there and a way to continuously charge that if it's a hand crank or if you have a bunch of batteries available. And then your low tech communications would be a whistle, a Sharpie, paper, just any way to help communicate, your radios within your facility. And then sheltering items could vary depending on, what you're using it for, but could be tarps, could be, you could use a cloth litter as like a shelter as well. Contractor bags, whatever it could be, can really, help you in a pinch. You're trying to just solve problems. And so any of those items can help you solve a problem in a disaster. Some other general items that can help you solve those problems is going to be Gorilla Tape, work gloves, binder clips, zip ties. Those are going to be your essentials, a multi-tool with a knife and a can opener, all those things. And then some reference materials as well. So any sort of pocket guides, handouts that you can include that will help provide your staff with information on how to troubleshoot problems in a disaster is going to be really helpful. So we recommend having these sorts of items in a kit that's stored, ready to go. Of course, you are, checking, maintaining that condition, checking the expiration dates, and you are training your staff on how to use the items in the kit, and you're exercising with the kit. So So, if you're doing an exercise soon, include the kit and say, hey, remember, someone go grab the kit and exercise that. See if they can access it. They know how to use the items in it. And this is just a really good thing to have at the facility level and at your home, something that's portable. These are rolling duffel bags, is how we've built them previously. So each kit was basically a copy paste of one another, and you get two rolling duffel bags full of items. And so, more specifically, we built these kits recently for the Low Country Healthcare Coalition region in South Carolina. And so, if you scan this QR code, and I'm sure, we'll have the slides sent out after this presentation. If you scan that QR code, it'll take you to our webpage where we put all of our EP kit resources together for that Low Country project. And so it lists all of the items that we included in the kit. And remember, there's no one perfect kit. It's kind of just what items were available at the time with the budget we had for the people we were building it for, all of those particulars. But it's a great place to start. It's a great way to get ideas. So we include all the items that we put in the kit, why we put them in there, how to store them, how to train them, how to maintain it, along with a maintenance log, an inventory list, and then videos on how to use the products. All of that information is there on that QR code. So definitely scan that and get that information. So we're very happy to share it with you. All right. So now we're going to get more into the planning side of the thing. So getting into it, looking a little dark and ominous here, but we're going to get into some of those planning best practices and what we can do to actually prepare our facility, our staff, our residents for a disaster. And so our guiding principles at IDM is that, yes, you should be, doing this emergency preparedness, all this stuff to meet your requirements. That's great. However, we really want to make sure that it's effective and specific to your facility. So if it's comprehensive, it's going to meet your requirements as it is. So building a program that is effective, meaning it works for your facility, it works for your staff, they know how to implement it. It's not overly complicated, but it has all the nuts and bolts that you need, and then specific to your facility. So if you download a plan off the internet, that's totally okay, but you can't copy paste it and put your facility's name on it. You have to read through it and make sure that it's still applicable to your facility, or even from your corporate level. If they give you one, you have to make sure it's specific to your specific building. Because if you tell everyone to, take cover in the basement and a tornado comes and everyone's looking for the basement and there isn't one, that's a big problem, right? You got to make sure that it's actually specific to your building, and that can be a big component there. But if your program is comprehensive, you really shouldn't have to worry about a whole lot of the regulatory requirements, because if you start digging into it, if you look at it from more of a pessimistic side of, well, if this happened, how would this work? And if this happened, how would this work? Would we be able to handle this? You'll start having all these plans and policies, procedures together, and it'll be so comprehensive. Will just blow the requirements out of the water. You're like, yeah, of course I have that. I also have three other things. So we want to try and look at it from that lens, because the regulations are important. If we didn't have them, we might not be, performing everything that we're doing up to that standard, because it's a very long list. But they are great encouragement for getting that done. Our biggest pieces of advice here are going to be to not reinvent the wheel. We have tons of resources available, partners are available, templates, all of that. You should never open up a blank Word document and sit down by yourself and say, okay, I'm going to write my plan today. So it's not how we want it to go. And we'll tell you how it should go. But then, of course, relying on community partners. So there's a ton of partners involved in this that have a lot of knowledge and skills and resources in these areas that we definitely want to point you towards. So in terms of the planning process, step one is going to be forming a core team or a group. So when I say, sit down by yourself and open up a Word doc, yeah, we never want you to do that. We want you to find a group. So at your facility level, you could include someone from corporate structure if, they've done this a lot, and or if they want to look into it as well. But just some people at your facility that are, well acquainted with how you operate, how your building's laid out, how do the day-to-day operations work, and what are going to be the really, top priorities, those life safety, property, business things, how to continue operating when a disaster happens. So forming that group first. Then you want to conduct a hazard vulnerability analysis, or an HVA, and we'll go into what that is here briefly. And then drafting and updating your plan, your policies and procedures, and then applying that all hazards approach to your plan, to your policies and procedures. So we want to plan by impact and not by hazard. So if you think about all those hazards we listed earlier, hurricane, flood, heat, snow, power outage, whatever it is, you want to actually plan by that last one. So plan by your impact instead of your hazard. So plan of, a hurricane or a tornado, yeah, both of them could cause a power outage. Okay, both of them could cause a loss of water or internet or, whatever it is. Or maybe, a hurricane and a snowstorm, they could also both impact transportation. Do we only have one road in and out to get to our facility? Are we up on a hill and it's going to be hard to get to, or in a valley and it might be more prone to flooding? So, thinking about the end result and what part of it is going to be a big issue for you, what's going to be the problem? Is it going to be transportation or not having power or not having water? It's not that a hurricane is here. Like if a hurricane's here, that's great, but why is that a bad thing? So just think through that a little extra step there. When you actually go to write your plan, we, generally in this field, will refer to it as an emergency operations plan, or an EOP, but different regulations, federal and state even, call them all kinds of things. So you may hear an emergency preparedness plan, just emergency plan, a disaster preparedness plan. You may hear all of those things. And so really we're all kind of talking about the same thing and calling it something different, just whatever plan you have for your facility of what you're going to do when a disaster happens. And it's more of a process than it is a document, right? We want it to be a framework for how those response operations are conducted so that if someone picks it up, you can immediately know, oh, okay, this is how this is supposed to work. So we want it to be a living document. It's never done. As soon as you put the final period on the plan, it's going to be immediately outdated, right? You're trying to figure out, as Christine said, those staffing changes. The communications plan is one of the hardest components to update because you have all of that turnover, and trying to keep all of that up to date can be really difficult. But there's no perfect template for a plan. If you find, 2 or 3 different templates online, if corporate gives you a template, you're, considering some options. Do you mesh some together? What's the best one? Well, that's going to be a question entirely for you. What's the best one for your facility, for your organization? It's okay to admire and acquire, as we say, from other organizations and other templates. Just put a line in there like template adapted from so and so's, give them credit. That's completely fine. We just want to make sure that the information is specific to you and updated with your information. You could have the best plan in the world, and if it's not known by all your staff and personnel, it's not going to be very effective. So we need to make sure we're training on that, and then of course not being drafted along with that team here. So some characteristics of a good plan is going to be some clearly defined triggers, that it's regularly trained on and updated, supported by resources, and supplemented by annexes. So CPG 101 is that comprehensive preparedness guide, and FEMA just put out a new one. The previous one was from like 2012, 2010 maybe. So it's been a while, but we just got a new one out. So definitely take a look at that. And that whole concept basically is that you have a smaller plan, like a base plan saying this is how we're going to operate in our response. And then you have annexes for particular hazards. So here's how we're going to operate in our response. And then specifically in a power outage, this is how we're going to operate. Specifically in a water outage, this is how we're going to operate. Evacuation, whatever it is. So that's going to be really important as well. And yes, I will touch on tabletop drills as well. I do see that in the comments. That's great. So when we talk about an HVA, it's just that systematic approach of identifying our risk and our hazards. And so just going to quickly go through these, but our 4 steps here are going to be identifying the hazard, assessing risks for each one, comparing them to each other, And then the last one's probably the most important is treating your hazard risk according to prioritization. So no one has an endless supply of staff or endless budget for emergency preparedness, right? So we have to make sure that when we do this HVA, we don't just look at it and say, oh, great, floods are top hazard. All right, well, we're going to get wet. Like, that's not how we should go about it. If we have, so many dollars in our preparedness budget, then we want to make sure we're spending most of that or a good portion of that to our top one, two, three hazards. So, okay, we're going to spend more on sandbags or whatever it is for that hazard. So when completing an HVA, you want to list all your hazards that you could have, really brainstorm, try to think through everything that has been an issue, could be an issue at the facility level. Then you want to assign it some risk. So what is your risk for that hazard? And that's going to be your hazard times vulnerability. When we say vulnerability, we mean your likelihood that it's going to happen, the impact that it could have, and the length of recovery. So thinking about, a major hurricane versus a, ransomware cyber security attack. Those are very different hazards that could have a pretty long recovery period, but very different impacts. So thinking about how those are going to rank against each other. So that's our third step is ranking them, comparing them to each other, and then treating those according to prioritization is that last one I mentioned in terms of which ones should we focus on and which ones do we not have the time, money, energy to focus on right now? And so eventually, if you do this HVA process, you should be able to put it in a matrix like this based on probability and impact to where your high impact, high probability incidents, the ones in red, are going to be the ones you really focus your time and energy on, including doing exercises. So tabletops. Full scale exercises, drills, anything like that should be focused on those top hazards, not on a less commonly to occur hazard. This is the Kaiser Permanente HVA tool. We don't sell health insurance or anything like that, but we definitely recommend their tool. It's one that's been widely used for years now. And so it's, free to download. It's a whole spreadsheet where you can enter your different hazards and then, rank them based on that probability, that impact, say, okay, floods are top hazard, cool, for whatever year you're working on. And then if you are tracking that information in the tool throughout the year, at the end of the year, it'll give you a report that says, hey, here's how often flooding actually occurred. It was actually like the fourth most common thing instead of the first. So power outage should have, been at the top. And so next year you can reevaluate and, decide which things to spend more time, money, effort, exercises towards. So it can be a really helpful tool if you continue to use it and update it. And of course, we say annually because a lot of times those are your requirements, if not every other year. HVAs I think should be, more closer to like biannually or quarterly, because it's, hurricane season's not all year round. And if we were having this meeting in December, we wouldn't be talking about hurricanes, right? So it's hard to have one HVA for a whole calendar year, but it can be difficult to plan season by season as well, especially for some longer implications you're trying to plan for. So training and exercising, huge component in preparedness. We want to make sure that we are, doing tabletops on our top hazards. So that is a lot of the same principles in that you want to make sure you're getting a group together, your, exercise planning team, you're planning that for your facility, and you're really just practicing your plan. So even though your people are carrying it out, you're not training, you're not exercising your people, you want to exercise your plan. And so what that means is that it's a no fault environment. It's not, well, you didn't do this well, and so now you're not going to get a promotion or anything like that. No, we want to find gaps in our plan. And so whether that gap is, do they know the plan? Did they, follow the plan or did they do something different? Then that's a gap. That's a training gap that we need to fill. Or maybe they followed the plan, they did it correctly according to the plan, and it didn't work. Okay, great. Well, now we'll update that and we'll do it differently next time. So trying to find those gaps is going to be the biggest thing in an exercise. You never want to have a tabletop exercise, a full scale drill, whatever kind you're doing, and get to the end and say, yep, we did everything great. It's like, well, then we kind of just wasted everybody's time because that's not actually the point. We want to make sure we're, working out all the bugs, working out all the kinks before something really happens. And then, of course, if you didn't document it, you didn't do it. So when a surveyor comes, they want to see your reports for all these things. You're going to need to show that. So that's really important as well. So going to move through quickly here on our last section, but this is going to be our community partners bit. So this was our title slide and a little bit of facetiousness there because yes, it can seem like really dark and ominous and scary, but it's not just you. You are not alone in this. And so if there's anything you get out of this session today, it's going to be that you're not alone in this. So there are tons of community partners out there that have been working in this area for years and years, specifically to healthcare. And we want to make sure we're really tapping into them. So I'm going to just do a quick overview on some different community partners that you should be engaging with if you're not already. And so if you, are a studious type, I would consider this your homework is reaching out to these community partners, see who your contacts are, and then making those connections because the biggest part of this is your relationships, building relationships with these partners so that they know who you are, you know who they know where you are, all of that before a disaster happens. So really big piece there. The first group is our healthcare coalitions. And so they are a multi-agency coordinating group. And so basically they have all of these groups together that help plan for, prepare for, respond to, and recover from disasters specifically related to healthcare. So you have hospitals, long-term care facilities, then you have schools and police departments and, universities, and all kinds of people all together working towards how do we prepare our healthcare system for a disaster and then respond to it and then recover from it. So South Carolina has 4 regions. So Georgia has 14, so a little more to keep track of. South Carolina is very nice. And so you want to make sure that you are in contact with those facilities, excuse me, that leadership for your healthcare coalition, because they have a ton of resources available and trainings available. So every year, the federal government, sends money down to the state, and then the states divvy it out to their healthcare coalition regions. And it's based on you, the healthcare coalition members, to tell them what do you need? What training do you need? Do you need a whole day of emergency preparedness training? Because it's really hard to fit a lot of stuff in an hour, right? So tell them that's what you need, and that's what they're there for is to serve you. So really important to know them and go to their quarterly meetings. Like 99% of the stuff they do is free and actually, paid for by your taxpayer money. So definitely utilize them. Next group is Emergency Management Division. SCEMD in South Carolina is really great. They have a lot of cool resources out there. It's very important to know who your county level emergency manager is because they submit resource requests for you in a disaster. So if you need a bus, if you need more oxygen, if you need, whatever it is, they're going to be those people actually submitting those requests. So it's a good idea to know who they are before the disaster. This QR code is for the SCEMD Hurricane Guide for 2025, and they always do a really good job with that. So make sure you get that one as well. Then we have DPH Fire and Life Safety Division. And so this one may be a little surprising to you that it's on here as a community partner. They are your surveyors for life safety code. And then depending on what facility type you are, they may also be your surveyors for E-tags. We did a 3-year project in South Carolina with skilled nursing facilities. And so they Fire and Life Safety does survey them for E-tags. And so they actually came to every one of our classes. They presented on the survey process, on the E-tag trends, why people were getting cited for those, what they can recommend, all the things that can't normally occur during a survey, right? They love to educate. Their mission is to provide education to protect your fire and life safety here. And they have a really knowledgeable team. They typically can't give you that education and tell you all that information while they're walking your facility in a survey. So we really loved having them as a partner, and they should definitely be a partner of yours as well. They'd love to answer any questions that you have. Some other partners to include going to be, of course, Constellation Quality, so providing other resources, trainings, things like today to give you information, other associations. So if you are, South Carolina Healthcare Association or Leading Age or whoever it is, they can be a great resource as well to give you information. other volunteer groups. So maybe you have a amateur radio at your facility, but you don't have someone to operate it. You could reach out to ARES, Amateur Radio Emergency Services volunteer group, and they send out ham radio operators to come operate your ham radio because you do have a license, have to have a license to do that. You can't just pick it up and use it. And so other external agencies, you want to just be thinking through who's near me, who has some resources. Is it a nearby school? Is it a nearby, I don't know, other facility that just has a big parking lot that you might need to use to stage some vehicles to evacuate, thinking through anything else. It could be another facility that's not part of your corporate structure. This is not a time for competition. And that's really the best part about healthcare coalitions is that it's the one time where we can bring everyone together and all these different, agencies, organizations that would typically be competitors are actually all planning together to work towards the same goal of preparing for the next disaster. So whoever you involve in your plan, you want to include them in it, but also include them in the planning. So if you are planning on a group showing up and helping you and, feeding you or anything like that in a disaster, and then the disaster happens and you say, well, where were you? You didn't come. It's like, well, you didn't tell me. You didn't tell me I was in the plan, so I didn't come. So you have to make sure you do both sides of that to really incorporate all of it. This is just a quick list of some of the resources. I mentioned one that I haven't mentioned before is the FEMA IS courses. So we usually recommend those for incident command. So if your organization is using incident command system or you want to look into it to consider using it for any sort of response operations, we recommend IS 100, 200, 700, and 800. Can't say they're the most exciting courses you'll ever take, but they are informative. Of course, in bold caps there at the bottom's community partners that we mentioned. And then lastly, I do want to just give a plug for a new program that we are starting in our office here. And so this is the South Carolina Long-Term Care Infectious Disease Educational Program. And it is a 2-year program funded by CMS CMP funds. So it is limited to skilled nursing only, no CRCFs, hospice, anything like that. But we have 2 courses that we're teaching. They're 1-day in-person classes. This is our schedule that's up here. And if you scan that QR code, it'll take you to our webpage for the program. The courses are designed to be for anyone at the facility level, so clinical and non-clinical skilled nursing facility staff can attend. We typically see our administrators because we do offer 6 hours of NAB credits. There's no cost to participants for the program, no cost for NAB credits, so come and get your 6 hours. And then we also see IPs, DONs, dietary, environmental services, all different staff members can come and attend these courses. And so there's more information on our website in terms of different topics that are covered. You don't have to take one before the other. There's no prerequisites, but definitely invite y'all to check that out. And we'd love to see you at an upcoming course. They're starting very soon. Seating is limited, so make sure you're registering if that's something you're interested in, and make sure everyone at your facility is registered that you would like to attend. And so that is all I have with 1 minute to spare. And thank you again so much for having me. I'll pass it back to Peggy here, but feel free to follow UGA IDM on any of our socials. We have a really great YouTube channel as well with a bunch of educational videos that we've produced. And yeah, feel free.
Thank you so much, Alyssa. This was excellent. And the resource you gave us also were very helpful. So I made notes of those so we can pass that along. And want to let everybody know as well that this was recorded and it will be available on the Constellation Quality Health site on YouTube. So please share it with other management members of your management team and anyone else that you think would benefit from it. So this is great information as well for your tabletop drills. So thank you. Greatly appreciate your assistance with this and your leadership for all you do with disaster management.
Thank you so much.
Thank you, everyone.